Hello, I'm Dr. Linda Jones. Comprehensive medical overview of malaria. Dear viewers, today I will provide you with a detailed clinical explanation of malaria, known in medical literature as malaria. First, I must emphasize that malaria remains one of the leading causes of death from parasitic diseases worldwide. The Plasmodium parasites that cause this disease enter the human body through the bite of infected Anopheles mosquitoes. Let me explain this process. When the mosquito feeds on blood, it releases sporozoite-form parasites into the bloodstream. These sporozoites quickly reach the liver, where they begin to multiply. After completing the liver stage, the parasites enter the bloodstream and infect red blood cells. It is at this point that clinical symptoms begin to appear. In my clinical practice, among the typical symptoms I frequently encounter, the most characteristic is paroxysmal fever. Patients often describe a three-stage fever pattern. First, a 1-2 hour cold stage with chills, followed by a high fever stage that can reach 40 degrees, 104 degrees, and finally a stage of profuse sweating as the fever subsides. This cycle repeats every 48 to 72 hours, depending on the parasite's erythrocytic life cycle. During physical examinations, we often detect hepatosplenomegaly, enlarged liver and spleen. Laboratory tests may reveal anemia due to hemolysis, thrombocytopenia, and elevated liver enzymes. Particularly in Plasmodium falciparum infections, neurological symptoms may develop due to central nervous system involvement, which can lead to life-threatening cerebral malaria. The gold standard for diagnosis remains microscopic examination. Peripheral smears and thick blood films examined by an experienced technician can reveal the parasites. In recent years, rapid diagnostic tests have also become widely used. When determining treatment approaches, we first consider the Plasmodium species, the patient's clinical condition, and regional drug resistance patterns. For uncomplicated malaria cases, oral artemisinin-based combination therapies, ACTs, are our first choice. In severe cases, parenteral artesunate or quinine administration may be necessary. During treatment, patients must be closely monitored, with particular attention to fluid electrolyte balance and kidney function. Regarding prevention strategies, we recommend chemoprophylaxis for individuals traveling to endemic areas. Medications such as mefloquine, doxycycline, or atovaquone proguanil should be used according to specific protocols before, during, and after travel. Additionally, mechanical protection methods like insecticide-treated bed nets, DET-containing, repellents, and proper clothing are highly effective. Finally, I want to stress this point. Malaria is a completely curable disease with early diagnosis and proper treatment. However, treatment delays significantly increase mortality rates, particularly in P. falciparum infections. Therefore, malaria must always be considered in the differential diagnosis of any patient with fever and a history of travel to endemic areas. I wish you all good health. Remember, this information is for general medical education purposes only and does not replace personalized treatment plans. For any health concerns, please consult a medical specialist.